Hello for everyone, guys. Today we will talk about sexual developmental disorders in girls. Normal sexual development, the period of puberty takes about 10 years in time, 7-8 years from up to 16 years. Maturation of the reproductive system, the physical development of the female body ends, body height and length, classification of the growth zones of tubular bones, formed physique and distribution of adipose and muscle tissue according to the female type. Factors. Which factors lead to sexual development of girls? The reproductive system during puberty is characterized by increasing sensitivity to the effects of both favorable and unfavorable factors. Since the mechanism of its implementation is in the stage of formation, numerous factors influence the onset and the course of puberty. Hereditary constitutional features, the state of somatic health, pathology of the gonads or a violation of the regulation, infection and somatic disease, endointoxication, endocrine metabolic pathology, mental illness and the state of the nervous system, body weight, unfavorable antenatal history. External factors. Food. Yes, now food. Yes, if you will talk about food, for example, diet has the greatest influence on the onset of puberty, especially in girls. Additional calories, in addition to those required for growth and activity, are stored in the form of subcutaneous fats, and fat is necessary for caring and feeding offspring. Therefore, a certain amount of fat signals that the body has enough energy for puberty and fertility. Vegetarian families, for example, have a later onset of puberty in girls than in families that eat animal fats. Yes. Climatic, geographic, yes, socioeconomic, environmental, physical activity, stress, now stress in the first place of all disease, risk factors for disease, bad habits is using narcotics, um, psychoactive substance, yes, smoking, alcohol, classification disorders, premature sexual development. Premature sexual development, which divided to the isosexual form and heterosexual form. Isosexual form, female type, and heterosexual form, male type. Delayed sexual development. Next, lack of sexual development and fourth, genital malformation. Genital malformation divided to hermaphroditism and malformations of uterus and vagina. Mm, Now we will talk about isosexual type, female type, yes. Premature sexual development, isosexual form. Onset of secondary signs and demands before the age of 8. Frequency 2% among gynecological disease in girls. It happens through cerebral or constitutional premature sexual development, false ovarian tumors. Now we'll talk about truths about cerebral forms. Next, here you see is scheme of regulation sexual development. Hypothalamus produce gonadotropin releasing hormones, which triggers the synthesis of luteinizing hormones. Gonadotropin releasing hormone secretion, yes, which triggers the synthesis of luteinizing hormones and the follicular stimulated hormones in the pituitary glands. Luteinizing hormones and the follicular stimulated hormones in turn on the gonads stimulated androgens in the ovaries and estrogens in the ovaries. Premature start can be a consequence of damage to the nervous system and a consequence of trauma, the presence of a mass in the brain. Sometimes it so happens that the examination does not cause the reasons caused by the so-called unreasonable central premature sexual development, the premature activation of central mechanisms that regulate puberty, sexual development is gonadotropin independent premature sexual development causing pituitary gonadotropic hormones. The central mechanism for regulation sexual development are located in the hypothalamus and the pituitary glands. Mm, where hormones are produced that affects hormone producing cells. Here produce hormones, gonadotropin hormones, luteinizing hormones, and follicle stimulated secretion, which affects to hormone producing cells in the ovaries and the females and the testicles of males, yes, stimulating the production of sex hormones, the estrogens in girls and the androgen in males, yes. Okay, next, through through premature sexual disorders, cerebral form, premature activation of hypothalamic, pituitary, ovarian systems due to functional or organic damage to the central nervous system. Functional damage, central nervous system, tonsilogenic infection, but hemolytic group B, yes, infections transferred in the first years of life, adverse effect during the gestation of a girl's toxicosis, complications in childbirth, organic damage to the central nervous system, birth trauma, cerebral infections, meningitis, encephalitis, hydrocephalus, a brain tumor. True. In this picture, you see full form is isosexual premature sexual development. Girl 10 years old, menarche from 6 years old, height 152 centimeter, bone age 16 years. Full form characteristic with development of secondary sexual menstruation do not differ from physiological norms, but the pace is accelerated. The growth zone closed earlier and therefore the growth of such girls is not high, within 150-155 centimeter. In complete form, there is a varying degree of development of secondary sexual characteristic, but in the absence of maturation, premature development of sexual hair growth, premature development of the mammary glands. Clinic. When examining a girl up to 8 years old, a pronounced femininity of the figure and increasing in the mammary glands, hair growth of the pubis and labia are noted. The development of the external genital organs corresponds to that of 11-12 years old girls. There is an increase in the labia minora, thickening of the mucous membranes of the vulva and the hymen so that the impression of juiciness of the mucous membranes is created. Vaginal discharge of a milky color. The condition of the external genital organs and the vagina corresponds to puberty and is completely uncommon for children. In patients, there is an increasing in the size of uterus. In the ovaries, there is more or less pronounced development of follicles. Treatment. Observing girls with full premature sexual development presents certain difficulties. A child with enlarged mammary glands and hyperfeminose by your appearance uh, attracts special attention of not only peers but also adults. Menstruation in girls 3-4 years old causes additional difficulties and the need for special care for the child. All this makes it difficult for the child to stay in the child care. Hormonal study reveals an increased levels of secretion of gonadotropin and the sex hormone for the child's age. Growth differs not only in the premature development of secondary sexual characteristics, but also in growth that exceeds the growth of their peers. Girls stop growing earlier. Their final growth does not exceed 150-155 centimeter. Treatment. Currently, premature sexual disorders is effectively treated with their analogies and gonadal. The principle of therapy is based on reducing the sensitivity of pituitary glands to gonadal when using its long-acting analogs gonadal. Long-acting diceptyl depot is especially effective. Now, we talked about cerebral form. Now we will talk about constitutional form. True premature sexual disorders, constitutional form, earlier onset of puberty. Second, the pace and the sequence of the puberty process is not disturbed. Third, the duration of puberty is not impaired. Fourth, genetically, a girl matures earlier. Um, and we finished truth form. Now we start with false form premature sexual disorders. Peripheral, yes. Hormonal active ovarian tumor or back adrenal gland, granulosa cells, tetracellular tumors, teratoblastoma or chorion epithelioma, a symptom of a feminizing tumor. Violation of sequence of the appearance of secondary sexual characteristics. Usually the first to appear are cyclic bleeding, signs of severe estrogenization, external genital organs, positive symptoms of the pupil, increasing size of the uterus, in the absence or weak development of secondary sexual characteristics. At recto-abdominal, the study determines the ovarian tumor, which is detected by ultrasound. The secretion of estrogen is many times higher than the age norm, when the secretion of gonadotropins is normal for girls and gonadal. False peripheral forms of premature sexual disorders, hormonal active ovarian tumor or back adrenal glands, granulosa cells, tetracellular tumor, teratoblastoma or chorioepithelioma. Treatment. Surgical treatment will remove this tumor. Premature sexual development symptoms disappear after 2-3 weeks after removal. After operation, the girls must be under the supervision of a gynecologist by during 2 years. Isosexual female types. Heterosexual premature sexual development. Most often the causes of heterosexual premature sexual development in girls is viral from congenital hyperplasia, back adrenal glands, adrenogenital syndrome. Congenital hyperplasia, back adrenal glands, a group of disease inherited in an autosomal recessive way, in which production is impaired adrenal cortisol. Genesis associated with adrenal hyperplasia include enzymes involved in steroidigenesis, chain of reaction to the convert cholesterol into steroids. Congenital hyperplasia back adrenal glands, a disease caused by a deficiency of enzyme system back adrenal glands, most often 21-hydroxylase. This process begins already in the prenatal period of the child's development. Fourth, high androgens level in the fetal blood causes masculinization of the external genital organs. Its severity depends on the degree of 21st hydroxylase deficiency. Cases of such pronounced masculinization of the external genital organs of a newborn are described as that her gender was defined as male, false female hermaphroditism, heterosexual premature sexual development. Characteristic is the acceleration of the growth rate of a girl, starting from 2-3 years with a gradual change in the body proportions towards masculinization. Along with this, the maturation of the skeleton is accelerated, so that by the age of 5-7 years the bone age is 5-7 years ahead of the calendar age. By the age of 9-13, patients stop growing due to the closure of bone growth zone. The final height of untreated patient is 130-150 cm from the moment the bone growth zones are closed. Sick children begin to lag behind their peers in growth. Fourth, the proportions of the figure are violated, manifested in a long body and short limbs. Androgens cause increased muscle development. Patients have broad shoulders, narrow hips, and developed pectoral muscles. Heterosexuals, premature development. Patients are treated with glucocorticoids. It must be permanent, carried out for life, with an infectious disease or surgery. The dose of prednisolone may be increased. Surgical correction of the external genitalia consists in removing the hypertrophied clitoris and dissecting the urogenital sinus. Children with congenital hyperplasia back adrenal glands should be under dispensary supervision with periodic examination of hormonal profile. Long-term treatment with prednisolone reduces virilization, hirsutism, slows down the growth rate and the closure of bone growth zones, which helps to lengthen the period of bone growth and increasing the length of the body and the limbs in children, as well as feminization of the appearance of girls. The plasty of the external genital organs is carried out in 2 stages. The clitoris is amputated at any age, immediately after the diagnosis is made, up to 4 years. The dissection of the urogenital sinus at 10-12 years. Delayed puberty. Delayed sexual development, the state of the body in which the manifestation of secondary genital signs and the basic physiological process, development mammary glands, the onset and the establishment of the menstrual cycle do not occur in the age period defined by the gynecologic practice as normal that is healthy. International Classification Disease 10 code EZO or delayed puberty. Premature puberty sexual disorders is observed in delayed puberty observed in 0.9 to 2% of children in the European population. Most patients have functional impairments associated with constitutional, familial, late onset of puberty. In 0.1% of adolescents, delayed puberty is based on the pathology of the hypothalamic pituitary system, hypogonadotrophic hypogonadism, or gonads, hypergonadotrophic hypogonadism. Criteria for delayed puberty. Puberty is said to be delayed when a girl lacks telarche, breast growth, by age 13 and or menarche by age 15. Second, along with above the absence of menarche by 15.5, 16 years of a girl's life, or cessations of the development of secondary sexual characteristics for more than 18 months, or delay in menarche for 5 years or more after the timely onset of breast growth, is also regarded as delayed puberty. Delayed puberty can be accompanied by a delay in physical development, especially growth. Classification. First, constitutional form of delayed puberty. A delay in the increasing in mammary glands and the absence of menarche in a somatically healthy girl over the age of 13 with an equivalent lag in physical length and body weight and biological bone age development. Second, hypogonadotrophic hypogonadism, delayed sexual development due to a pronounced deficiency in the synthesis of gonadotrophic hormones due to aplasia or hypoplasia damage, hereditary, sporadic, or functional insufficiency of the hypothalamus and or pituitary glands. Central genesis. Mhm. Hypergonadotropic hypergonadism caused by congenital or acquired lack of secretion of hormones of the gonads, ovaries. Delayed sexual development of central genesis causes cerebral disorder of an organic nature, psychosis, neurosis, including anorexia nervosa, weight loss, constitutional features, hypothalamo-pituitary regulation, hyperprolactinemia, functional or organic. Clinic delayed puberty. 1. Unihyoid physics, long arms, legs, narrow shoulder and pelvis, short torso. Explicit sexual infantilism, underdevelopment of secondary sexual characteristics. Lagging bone age. Diagnostic of delayed puberty. Patient goes to the doctor with complaints about the absence of menstruation and the delayed sexual development. When examination patients, there are no somatic anomalies, there is a proportional physics, the absence of weak development of secondary sexual characteristics, hyperplasia of the labia minora and the uterus, reduced size of the ovaries, atrophic type of vaginal smears. Ultrasound reveals a small uterus but not a heavy uterus, and small gonads, ovaries which may contain fluid inclusions which indicate the presence of a follicular apparatus. On radiographs of the skull and the stellar torsos in many patients, there are signs of increasing intracranial pressure or change in the volume of the saddle, increased digital impressions on the cranial wall, wide entrance to the stellar torsos, enlarged or reduced saddle size, saging bottom. Electroencephalogram data and examination by a neurologist may indicate the presence of hypothalamic insufficiency, dysfunction of cortical structures, less often on organic brain damage. Patients with delayed puberty of central origin are characterized by a high serotonin content in the blood, more than 0.6 millimole per liter, decrease in the excretion of norepinephrine below 70 nanomole per day, and the increased excretion of melatonin more than 15 nanomole per day. Gonadal forms of delayed sexual development. This is a rare form. There is no chromosomal pathology in the structure of the ovaries except for a decrease in their follicular apparatus. No changes are noted. These ovaries are hyperplastic. Causes: damage to the ovaries with toxins, ovaries, which lead to a change in their sensitivity to stimulating hormones of the pituitary glands. Lack of sexual development. Dysgenesis connotes any congenital disorders in the development of reproductive system in man or woman. It is an abnormal development of the gonads, ovaries in the fetus, in which the reproductive tissue is replaced by a non-functional fibrous tissue called the gonadal cord. This condition is a form of aplasia leading to hormonal deficiency, which manifests itself in the form of sexual infantilism and infertility. Puberty does not occur. Secondary sexual characteristics do not develop. Gonadal development is a genetically controlled process, depending on the chromosomal sex XX or XY, which determines the formation of the gonad, ovaries, or testicles. Causes: agenesia and dysgenesia gonads due to chromosomal abnormalities. The most common clinical form are typical form of Shershevsky-Turner syndrome, agenesization gonads. The erased form dysgenesia gonads, pure form dysgenesia gonads, mixed form dysgenesia gonads. Typical form dysgenesis, Shershevsky-Turner. Synonyms: ovarian dwarf growth syndrome, Woollich-Bonnevi. This syndrome was first mentioned more than 90 years ago. The syndrome is caused by chromosomal abnormalities. Most often we are talking about the loss of the sex chromosome, karyotype 45X0 or mosaicism, karyotype 45X0, the 46 double X, 45X0, 46XY, the result of which the sex gland is not formed. In place of the ovaries, there is a connective tissue cord consisting of the ovarian stroma. The follicular apparatus is absent. Here you see Turner syndromes: short stature, low hairline, characteristic facial features. Here you see yes, facial features, constriction of aorta, and electrocardiography and ultrasound investigation. You can see constriction of aorta, Doppler, uh, elbow deformity, rudimentary ovaries, gonadal streak, underdeveloped gonadal structure, no menstruation, small fingernail, no nails, brown spots navy. Here you see, yes, guys. Characteristics is clinical stigmas, short neck, high sky, irregular shape of the auricle, ptosis of the upper hilb, malformation of large vessels, congenital heart and kidney defects, lymphostasis lower limbs. There is a low body weight of the newborn. Pure form dysgenesis gonads or syndrome sphere. The disease was described for the first time 70 years ago. High growth somatic pathologies. Women figure resemble eunuchs. Secondary sexual characteristics are usually absent. The breast is absent or weakly developed in the form of hardened nipples. External and internal genital organs, female underdeveloped. Amenorrhea, delayed bone, absence of ovaries, hairiness, growing and armpits in the female pattern, increases secretion of gonadotropins. Treatment: Sex hormone replacement therapy indicated. With a high growth of patient and open areas of bone growth, treatment begins with increasing doses of estrogens. High doses of estrogens are needed to accelerate the closure of the bone growth zones and halt the growth of the yolk. This therapy is carried out for at least 6 months. Mixed form dysgenesis gonad. This disease is associated with dysgenesis testicle. Therefore, the karyotype of patient is 46XY may be mosaicismal structural rearrangement for chromosomes. However, Y is always found in the karyotype chromosome. Clinic. The syndrome is detected on the first birthday of the child. Anomalies in the development of the external genital organs do not allow determining the sex of the child. Most patients have a genital type with a hyperthyroidism, hypertrophied clitoris, labia in the form of a scrotum. The vestibule of the vagina is normal. The entrance is deep, reminiscent of a funnel. In adolescence, symptoms of muscularization and virilization appear. The magnitude depends on the maturity of the genital appendage. The patient has a lower tone of voice. The clitoris increases in size. Hair appears on the female type. Estrogen production is reduced. Violations of somatic development are observed, as in Shereshevsky-Turner syndrome. Changes in internal organs are practically not found. Thanks for your attention. We finished our lecture. At the last, I say how we can prevention this condition. Prevention, early diagnosis of congenital deficiency of adrenal steroidogenesis enzymes, genetic counseling, and the clarification of the presence of mutations in their uh, taking into account the data of the family history, dynamic observation of premature growth and growth during the first 4 years of life by a pediatric gynecologist, weight controls in children prone to obesity, especially in families with an abundant history, diabetes mellitus, metabolic syndromes, screening and inclusion of children with coffee-colored pigments, spotting found in the birth and high risk premature sexual disorders. Okay, guys, we finished our topic. Thanks for your attention.